daily without forgetting a single day, then probably you are going to live near normal life. But if you discontinue the medicine and then have a resistant associated mutation, probably you are going to lose your life. According to me, acquiring a HIV is not a big thing. Nowadays it is a manageable things, but starting the therapy and in the middle stopping it is unpardonable mistake which can take your life.
Why is adherence important?
Adherence is very much important because if you start therapy, the virus is killed for a particular time. So no sooner you discontinue the medicines, virus come from the organs into the blood and they start replicating. Because what we give the medicine, it does not reach the nucleus of the cell. As I said, the HIV virus remains in the chromatin material of the nucleus of the cell where the drug never reaches. So once you start the therapy, the virus from the blood is killed, virus from the semen is killed, but it is not killed from the cell. So once you stop it, the virus from the cell will come to the all the body fluids and it will have a resistance. And once you get resistance, means that type of treatment is not effective and you have to go on second line, third line, which will be very expensive and toxic and not that effective as the first line therapy. When you start the therapy, there are likely to be have a short-term side effects like a nausea, vomiting, diarrhea, giddiness, disturbed sleep, and so many things, fever, and lot of things can occur. But in any case, one has to continue the antiretroviral therapy. And if you want to discontinue also, then also you must see the ART specialist because there are different ways of discontinuing the therapy for a short period of time so that one cannot have a resistance associated mutations and the therapy should be intact. So never ever you can discontinue the HIV medicine even if you are admitted because of the therapy that you have started. So it is a ART specialist who will decide how to stop the therapy because there are different methods and mechanism where he can advise you according to the therapy which is recommended.
What if I have side effects?
Even if you are having a side effects, you have to continue, you have to reach the ART specialist and he will modify the regime according to the what side effects or toxicities you are getting it. So therapy is to be continued. If you are to survive in this world, then you have to take the therapy. You cannot discontinue it. The therapy can be modified, but it can never be discontinued.
Can my HIV drugs interact with other medications?
Yes, 100%. All the drugs have got a interaction with the antiretroviral therapy drugs. So you have to consult the doctor who is very much experienced in the HIV medicines. He can decide. It is also available on the website also HIV chart where you can yourself log on and find out the drug which you are using is having a adverse effect on your body or not. So it is highly recommended that whatever drug, even if you are taking grape juice also, it has got a drug interaction with the antiretroviral therapy. Probably the most common is the protease inhibitors. So everything and anything, you have to consult your doctor.
How long will my therapy last?
Therapy today's day, it is advised that you have to continue lifelong and till there is a breakthrough in the HIV cure, which is not seen in near future. It is for 10 to 15 years there will not be a cure. So till the cure comes, one has to take the medicine regularly and religiously to survive till there comes the HIV cure. So it is to be continued for a lifelong.
Can my therapy be ever stopped?
It cannot be stopped, but there are side effects and lot of toxicities, so it can be modified, changed, but it cannot be discontinued.
How will I know if my treatment stops working?
For that, we recommend HIV monitoring, CD4 and viral load. If the viral load which was undetectable at earlier level, now it is detectable and the viral load is above 500 copies per ml of plasma, then we say it is a viral blip or viral rebound. And if you recheck this viral load after 3 months and the viral load is still detectable and it is above 1000 or 1500, that means this medicine is ineffective and we say it's a virological failure.
What if I decide not to take medication?
If you don't take medicine or if you have taken the medicine and you want to discontinue it, these are two different things. If you are not taken medicine, then you can decide whether to take or not, because if the CD4 count falls below 200, then you are likely to get opportunistic infection and probably you can succumb to it. But once you start it and then the virus is exposed to the drugs and then discontinue it, then the virus become resistant to it, and probably after 2 years, if you are sick and you want to restart this medicine, then this medicine will not be effective. So you will be losing the window of opportunity that gives life for 15 years probably.
Should I take alternative therapy?
Alternative therapy means Ayurvedic or homeopathic therapy. The allopathic therapy is a widely used, the whole world uses the same, and there are many studies worldwide, and we recommend this regime when the FDA or there are US guidelines and European guidelines, UK guideline, WHO guideline, and an NACO guideline. After that, we recommend. But in alternative medicine like Ayurvedic and homeopathy, there are no specific drugs and there are no researches and there are no guidelines. So it is an individual doctor who decide what medicine is effective and what medicine is not effective. So it is just like a trial or somebody else opinion about the drugs and then the therapy. So I think allopathic medicine has got a better edge over the traditional alternate medicines.
What can I do about my body shape changes?
The body shape changes is affected by antiretroviral therapy drugs like stavudine, which is now phased out, and then the protease inhibitors. So the thing is that these are some expected, but with some lifestyle changes like a low fat diet, exercise, less consumption of alcohol and no tobacco probably will delay the onset of all these fat metabolism problems. But protease inhibitors do cause some problem of this body shaping. Dieting, exercising, low consumption of alcohol and no tobacco will probably have a good effect on what we are getting it out of these drugs. We can delay the problems.
Am I at higher risk of heart disease?
When a person is having a HIV viral infection, it's a inflammatory disease. So that also leads to coronary artery disease. But there are drugs also when we start antiretroviral therapy, they call hyperlipidemia and dyslipidemia. So that way also the lipid levels are increased and the person is at a risk of acquiring coronary artery disease. So HIV antiretroviral therapy, it's a double-edged sword. So when you are HIV infected and not taking antiretroviral therapy, even then you are at a risk of heart diseases. And when you are taking medicine also, then also you are at a risk of acquiring coronary heart disease. So the risk of heart diseases are more in HIV and HIV associated drugs. Yes, same way lifestyle changes, exercise, less of fat, then low consumption of less consumption of alcohol and no tobacco and periodical checkup with a cardiologist will probably delay or avoid myocardial infarction.
Can my liver get affected? How can I protect it?
Liver is a one organ which is bearing the burden of alcohol, drugs and HIV. So HIV is there, and it can be brought under control with antiretroviral therapy, which can cause some liver problem. But what we can avoid is again alcohol and tobacco. So liver diseases are likely to occur when you take antiretroviral therapy, but they are not so common. They are not uncommon, but the percentage of occurring liver disease are less than 1%.
Is there any risk to my bones and joints?
Yes, bones and joints can be affected by HIV itself as well as drugs, especially tenofovir and protease inhibitors like lopinavir, ritonavir combination. They are uh, causing the osteoporotic fractures. So we have to monitor these bones as well as bone marrow density to prevent the osteoporotic fracture arising out of HIV or the antiretroviral drugs.
What are opportunistic infections?
Opportunistic infections are, as the name suggests, that they are very much opportunistic. When the immune system is good, they are not attacking us, but when our immune system comes down, these are present in our body otherwise, and they become opportunistic and invade us. So when our immune system is good, they do not attack us, but when their immune system is reduced to less than 200 cells per ml of blood, they attack us and they could be fatal.
How do I prevent or treat TB?
Prevention in TB is not possible because our immune system in HIV is affected. It is very much down. So around 67% of the people who are HIV infected, they are likely to get a tuberculosis infection if they are not treated with antiretroviral therapy in time. So once we start antiretroviral therapy, we always try to rule out TB infection, because once there is a TB is ruled out, the IRIS, that is immune reconstitution inflammatory syndrome arising out of ART, is not there, which is very dangerous. It's a paradoxical reaction. So once we rule out TB, then there is no problem. But if we find any TB infection, then we have to treat the HIV infected patient for a TB with the AKT drugs first for 2 to 3 weeks, and then we add antiretroviral therapy to AKT, that is treatment for TB. So always we treat TB like treating the normal person with TB.
When do I need prophylaxis for opportunistic infections?
The prophylaxis one has to take when the patient is not taking ART and he is newly diagnosed that he is HIV positive, and the doctor will recommend prophylaxis if his CD4 is below 250 cells. He should consult the HIV specialist for the prophylaxis.
Can HIV cause cancer?
Yes, HIV can cause cancer, but once person start antiretroviral therapy at early stage, this can be avoided. So it is better to start ART at earlier stage to avoid all these cancers in life.
Will HIV infection make me age faster?
Yes, if somebody doesn't take, then HIV is going to cause frailty. That means patient will look old. So if somebody start antiretroviral therapy, this can be avoided. And if the patient is starting HIV treatment at early stage, then he will look like a normal person, and no one can make out that person is HIV infected.
I am getting some white patches in my mouth. What's wrong with my mouth?
If the patient is on antiretroviral therapy or patient has never experienced any HIV treatment, then in the oral cavity one can get a curdy white material that is called candidiasis. So candidiasis means the patient's immune system is very much low. So one should check CD4 count if he is HIV positive to know that the drug that he has taken is effective or not.
What can I do about nausea and diarrhea?
Nausea and vomiting that can occur in a HIV infected patient, and if he is related to drugs, then he should probably ask ART specialist to treat this nausea and vomiting or diarrhea arising out of ART, he can change the drug if they are very frequently, because if he does not reach doctor and ask him about the therapy, then probably the drug which he is taking is not reaching the blood and he will not have a good control on the viral load and immune reconstitution will not be there. So it is always better to see the doctor and tell him about his simple nausea, vomiting and diarrhea.
Why am I losing weight?
Losing weight is common when the patient is HIV infected, but after starting antiretroviral therapy, weight will not be lost, he will regain the weight. So it is always better to start therapy and adhere to it.
Can HIV affect my nervous system?
Yes, HIV can affect the central nervous system. Patient gets headache, then vomiting, and then the seizures, that is having a convulsions, and patient can be having a paralysis also. So it is better to start antiretroviral therapy at earlier age to avoid all the opportunistic infection or complications of the disease.
I am HIV positive. And what if I want to get pregnant?
If woman is HIV positive, she wants to become a pregnant, she can very well become a pregnant, and if she is timely taking antiretroviral therapy during the pregnancy period and then the elective cesarean section and breastfeeding to be avoided, or if pediatrician is contacted at the right time, so we can avoid it. HIV transmission from mother to child is avoidable, and it is said in a IS conference that by 2015 there will not be a single person, single child who will be born HIV positive. So this PMTCT will be out and it will become as a history.
How can I father a child with an HIV negative woman? Or
My husband is HIV positive and I am HIV negative. Can I conceive?
Yes, this is very well possible that the person who is HIV positive and whose wife is HIV negative, the wife can become a pregnant and a HIV negative baby will be born. This is called a discordant couple having a child who is supposed to be HIV negative, and it is everybody's liking that they should have a child and they should parent the child and baby should be negative, and there are assisted reproduction technique, timed assisted reproduction technique, that is IUI, intrauterine insemination, sperm washing done by the infertility specialist, and preparing the woman for a HIV negative status all throughout is a skill of the HIV or ART specialist, and it is very well possible, and it is since 1998 the first hospital in the world, that is the Chelsea and Westminster Hospital in London. They have done lots of research on this, and the babies are born negative and the woman is not infected with HIV, though her husband is HIV positive and is taking ART.
what if my child is HIV positive?
If the child is HIV positive, then one has to start antiretroviral therapy immediately so that he should not acquire opportunistic infection. The main aim is to have his viral load undetectable and his CD4 percentage above 25%, because in the child we have to look for the CD4 percentage, not the CD4 absolute count. There is a lot of problem in children, because to me they are coming for the treatment but they are not aware of it, for what they are taking treatment, and as they grow and older, then they see my letterhead and board outside that they are visiting skin and HIV specialists, and then they feel sometimes disturbed and ask for what I am taking medicine, though I am not having any skin disease. But the disclosure has to be made by the very competent counselor, what I feel, not even the HIV and ART specialist. So that is very difficult to disclose the HIV status to a child.
How and when should I disclose my HIV status to my partner?
What I feel, as and when you